Hello and welcome. Today, we're going to dive into a story that starts with a problem I think we've all experienced just total communication chaos at the doctor's office. But what starts as a pretty straightforward fix, well, it turns into this massive vision for the entire future of healthcare. Let's get right into it. This quote, wow, it really gets to the absolute heart of the matter, doesn't it? The biggest breakdown in healthcare often isn't about the medicine itself. It's about the connection, or the lack of connection. It's those broken links in the information chain. And that's exactly the problem we're unpacking today. All right, so what does this communication chaos actually look like on a normal day? Let's take a peek into the daily reality for the folks right on the front lines. I mean, just try to imagine you're at that front desk for a second. The phone is ringing off the hook, you've got a WhatsApp pinging about a prescription refill, there's a voicemail from a patient trying to reschedule, and, oh yeah, there's a person standing right in front of you. It is a constant, overwhelming mess of information coming from literally every direction. And this chaos, it doesn't stop at the front desk. Nope, it spills right over to the doctors. They're getting messages from patients late at night, often without the full story. Trying to piece together a patient's history from a bunch of random messages, it's not just inefficient, it's a perfect recipe for burnout. And here's the part that really matters the most, the patient side of things. You leave the clinic, right? You've got some instructions they told you, maybe a scribbled note, and a kind of foggy idea of what to do next. Are you taking the right dose? Did you misunderstand when you're supposed to come back? That confusion creates a ton of anxiety, and it can seriously impact your health. Okay, so we've laid out the problem pretty clearly. Now, let's look at the solution. This is where a platform called Ekko steps into the ring, and it's designed specifically to bring some order to all this chaos. This slide just shows you the difference, plain and simple. On the left, you've got the total mess we just talked about, but on the right, you see what the EK Ekko solution does. It takes that tangled web and transforms it into a clean, organized, and clear flow of information between the doctor, the staff, and the patient. So how does it pull this off? Well, it's a lot more than just a simple chat app. It's got these really smart features, like preset quick replies, and even AI that suggests prompts to help doctors answer faster. And for the front desk team, this means they can give consistent, accurate answers every single time. That's a huge win for efficiency. But wait, there's more. This is just the beginning. See, Ekko isn't just a single app. It's actually part of a much bigger, totally interconnected ecosystem. What we're actually looking at here is a suite of 3 different tools that all talk to each other. There's a mobile app just for the doctor who's on the move, a web dashboard that's like the command center for the clinic staff, and of course, a dedicated mobile app for the patient. They're all separate experiences, tailored for who's using them, but they're all syncing up in real time. And this table is great because it shows how everyone has their own specific job. The doctor's app is laser focused on managing care plans. The staff dashboard is all about running the clinic, scheduling, analytics, reports. And the patient's app is all about empowerment, letting them track their meds and see their own health info. Every part has a purpose, and they all just work together. Okay, so we've seen the tool, we've seen the ecosystem, but now it's time to pull the curtain back. Because Ekko, well, it's just the first domino in a much, much bigger plan. I want you to really think about this question for a moment. What if fixing communication wasn't the final goal at all? What if it was just the foundation you had to lay, to build something truly revolutionary on top of it? This is the big idea behind Slincas, the parent company. And this slide, this is the whole roadmap. Phase 1 is EKO. That's live right now, and it's all about fixing today's communication problems. Phase 2 is about building a network to make things like referrals super easy. Then, Phase 3, this is big. Creating a secure health data vault for every single patient, a single place for your entire medical history. And the final destination, Phase 4, is what they call autonomous healthcare. This isn't just about being efficient. It's about using all that data to predict health problems and automate care. It's a very deliberate journey from solving today's headaches to building a predictive future. So what's the end game here? They call it a healthcare super platform. The vision is one single smart app that connects every single piece of your healthcare journey from the moment you get a diagnosis all the way through recovery. It's a seriously ambitious goal. Now, a vision this big, you just can't do it alone. The final and maybe most important piece of this whole puzzle is partnership. To make this a reality, they need everyone to be a part of it. For clinics, this means less busy work and a lighter workload. For hospitals, it means having a much better view of what's going on. And for other partners and innovators, it's an open invitation to help build a future where all these different healthcare systems can actually talk to each other and work together. And this, right here, is really the key takeaway. That communication platform we started with, Ekko, it's not just a product, it's the bedrock. It's the foundational layer that this entire futuristic vision of healthcare is being built on top of. So I'll leave you with this final thought. We started this journey with the simple, chaotic sound of a phone ringing at a clinic's front desk. And we've ended up talking about the possibility of AI-powered predictive care. The road ahead is long, for sure, but if a company like Slincas can actually pull this off, it could completely change how we think about our own health. Is this the future we're heading towards? It's a pretty fascinating question to chew on.